And as usual, I just want to start out the class and ask how are you doing this week? What's been going on? See, we have
Doing
babies
well.
joining us tonight. Go ahead.
Probably feeling better.
You're feeling better?
Yeah, after I guess it's been what week? This is week 4.
Of like just getting situated, you mean? And like figuring out what's happening?
No, health-wise.
Oh gosh, I'm so sorry
Yeah,
to hear that. Well,
just
I
respiratory
understand what.
credits going around.
Yeah, I got the flu after our class on Monday. Like by Tuesday, I was bedridden the entire day and Wednesday. So I hope that all of you get to escape that because losing 2 full days of work is painful as well. I'm sure for you guys if you lose 2 full days of studying or productivity of any kind. How about anybody else? How are you guys doing?
I'm excited that it's going to be above freezing for more than a couple hours tomorrow. My
Yes.
driveway is so icy. I might get it clear.
I, yes, amen. I totally hear that. I think it says it's maybe here in Morgantown it's going to be 50 degrees, so we're definitely excited to hear that news. Well, what I usually like to do is just quickly touch base with what is due for what's coming up for us. Let me just pull up um, our schedule really quickly and I'll share it. Okay, move all my Zoom buttons around here. Okay, so we are today going to be searching for evidence, and we have Ashley Purvis, our librarian at a Health Sciences Center, joining us today. And she is going to lead class for us today. So if you will all get ready and get your screens ready to get on the HSC library site, she might have you do some exercises today. Um, you recently turned in your interview. I believe we have all of those graded, and we are so impressed with the work that you're doing and the data that you collected. So great job with that. Um, I don't know if you saw my message, but I moved your priority problem summary and PPCO question assignment back to the Friday before. I think it's like next Friday. It's like the 20th or something like that. You'll have to look in there to be sure. I updated that just to give you guys, because this is a group assignment where everybody has to work together and rate this paper. I am going to provide you with a model paper that I have created for you. It is not something that you need to follow um, exactly. You don't have to model it exactly, but it's to give you an idea of the expectations of what we want to see whenever you turn it in. So, and it will follow along with the case that we've been working on all semester so far. Um, I think that was the biggest update. So you guys saw the extension on that. This week we're searching the evidence. Next week we're going to be appraising evidence that we find. Does anybody have any questions before I turn this over to Ashley and let her introduce herself and talk about all the activities we're going to be doing tonight? Any burning questions? Okay, I'm hearing none. So the plan is I'm going to turn this over to Ashley and then she will do her thing for probably about an hour, hour and a half, maybe more. See if you guys have questions, see if she can help you search for some evidence. All of you should have a defined PPCO question coming in tonight after your group work last week. And then, like every week, I'm going to leave the last hour for you guys. I can break it up into small groups so that you can have time to work with your individual group members and then sign out whenever you're done, unless you want to meet on your own group time. That's also fine. I believe I have stopped my share. Ashley, I'm going to go ahead and make you co-host so you have the power to do whatever you like.
All right, sounds good. Thank you. Hi, everyone. I'm Ashley. I'm one of the health science librarians. I work with everyone in their classes and kind of just doing some basic searching. So thank you all for showing up tonight. We're going to try some group activities a little later. So bear with me. This is a kind of, you're my first class trying that out on Zoom. So I really appreciate any kind of uh, going along with the activity that might happen. So yes, I'm one of the librarians. You may recognize me. I actually was recognized after this class at my exercise class the next day after this class. So if you see me around, you can also say hi or ask me questions about whatever you're working on. That's totally fine. I tend to not be the best at looking at the chat. So if you do have a question and I'm not responding to it in the chat, just go ahead and start talking. That's totally fine. So I'm going to go ahead and start sharing. Let me see here. Okay. Oh, yeah, that works. Okay, great.
Ashley, I will try to follow the chats for you, so I'll just pop my hand up if I
Oh,
see something that you're not getting to.
awesome. Thank you so much. All right, so today we're going to go through let me get this going. We're going to go over evidence-based literature searching, which just means we're going to learn how to kind of put together search strings, and we're going to learn what all that means. Today, our objectives are to be able to break down the PPCO question and then create and run a search string based on that. Kind of go over, be able to explain what the evidence pyramid is, identify some inclusion, exclusion criteria. We're not going to go over that in great detail, but you'll have an idea of what that is at the end. Using some advanced search techniques, and then kind of knowing what to look for in predatory journals, if you get an email from them, things like that. So, all right, let me go ahead and get started. So some helpful tips whenever you kind of get started with your searching is you're going to want to prep your strategy before you begin. That'll help you get the most relevant results. You can kind of, go at it without any kind of strategy, but then it ends up kind of, you're asking yourself, what did I write down? What are my terms, things like that. So it's easier to kind of come up with that strategy. You're going to also want to create logins for all the databases you use, so you can save those searches. It'll also save your results in case you are forgetting something or you don't write it down. That is really helpful. You can also use this string across every database, so you don't necessarily have to come up with 5 different search strings if you don't want to for each database. And then always kind of search the same databases again with your new terms anytime you add a term. So those are kind of some helpful tips. So we're going to kind of get down to our PPCO question. And I know you've kind of gone over some of this already, but we're just gonna go over it again. It'll kind of help relate to how we're going to kind of build our search. So when we think about our PPCO components, we have our problem, population, change, and outcome. So that seems pretty easy, right? It's a little different from the PICO question, but this is much more geared towards having a QI project, right? And a lot of our work is done in the QI terms. So we're going to focus on just these 4 areas. So when we think about our problem, we're going to think about what's the general problem. Is it more general, or could it be specific? What's the context for this problem? Your population always refers to who is impacting, in relation to the problem. Your change is kind of what's the recommendation? What do you want that intervention to be? What is currently being done to address those problems? And then your outcome is just what exactly, what's reported, what is being measured here? What is your ultimate goal of implementing your changes for that problem and population? Does that kind of make sense to everyone? Is that kind of, we're getting that flow? Okay. So when we think about our research question, this is the one, my understanding, you've been kind of working on with class. When long-term benzodiazepine use is identified as a safety concern among patients age 65 and older in primary care, what evidence-based practices, changes, or strategies are effective in reducing long-term benzodiazepine use and improving medication safety? So that is quite a lengthy question, but something that, we do need to look at. And so when we have a really big research question like this, why we have those frameworks is because those frameworks will help kind of carry us past being overwhelmed by all of the turns of phrases in the question, just kind of, help us break down all the areas we're looking for. So if we take this question and we apply it to our PPCO framework, we have our problem being the long-term benzodiazepine use for adults over 65, and we're looking for evidence-based strategies that improve medication safety. That is our overall goal. So we want to kind of see what those are, for these patients. Is that kind of everyone following along so far? Is this making sense? Okay. So what you want to do after you kind of have this problem set up is you're going to want to think about setting up, what are some keywords? Obviously, when we think about our primary terms, these are kind of going to be your keywords. They're kind of going to get you started along. Now, some of these we do have as phrases like adults over 65. That might not necessarily be a keyword, but what we can do is we can kind of figure out, what would that keyword be from here. So when we think about our building our keywords and synonyms, what we want to think about is not just every word under the sun that necessarily may be related to medication safety, things like that, or seniors. You want to think about how other researchers are using those terms. And it's okay if you come up with some ideas for terms and you're like, actually, these are kind of terrible. You'll learn that along the way. You'll learn, every question is going to have better keywords than others. So it's just one of those things that you're kind of going to have to work at, and every question is different. When it comes to finding different synonyms for different keywords, if you can't think of them off the top of your head or you're not sure about spelling, because there is that UK English versus US English spellings, you can look at the dictionary. You can always look at the thesaurus. You could look at the Black's Medical Dictionary. All these resources are here to help you kind of gauge what those keywords and synonyms are going to be. So that is kind of something to think about as we kind of start building. So we're going to take a little break and I'm going to send you this spreadsheet that I forgot to do earlier. So let me pull this up. Okay, we'll figure it out. Downloads. There we go. All right, so I'm going to send you a copy. I'm going to upload its copy of a search template that I have. And what this is how I kind of build my search. So when I send this to you, you're going to go ahead and be able to put in your keyword, what you think it's going to be, and then think of maybe some synonyms. And we're not going to take a super long time on this, so don't stress out. It's just one of those things where it's good to just kind of dive into it. And once we kind of dive in, we'll kind of go over it together. So, I want you to think like, the term evidence-based strategies, that is kind of more just like, could be a placeholder for actual like, oh, what are some of these interventions that I could use? What are some of these other, so what are these strategies? You don't have to just use that term. If you're like, these terms I want to use different terms, that's fine too. But what I want everyone to do is kind of get started in that. And I'm going to upload this to the chat. And then I'm going to break everyone into groups so you can kind of work with a group and kind of see how it goes. And I'll give everyone a couple minutes to kind of go over that. Does that sound okay to everyone? And we'll do a couple, maybe like 5 minutes to think of some keywords and synonyms, maybe 7. So let me go ahead and bear with me because this is a whole new thing trying out. Oh, host tools. There we go. Okay. Where is it? I did see this earlier, so we're going to try. Okay. So we're going to do 5 breakout rooms. Okay, so they might be a little large, but that's okay. Actually, we'll do 6 breakout rooms. There we go. And then you'll be able to work together with that. And then there'll be some a co-host might be in there with you to help. So, all right, let's go ahead and get that started. Open all rooms. Oh, did we all end up in the same room together? Okay.
I think they're going to rooms. I've lost my view for some reason.
Okay.
Looks like there's just a couple more.
Hey Ashley, would you like me to join room 6?
Yeah. If you want to join room 6, that would work.
Sure.
You get experience. And I just need to set timer. I hope this goes well. I've never tried it in online before, so I was like, I hope they don't mind. We're gonna try. So
I just had somebody who had just joined the. We can just send Cheyenne to a room.
Yes,
there
Which
we go.
room?
sorry. Every time that I try to click on that chat, like the post that you sent us, it logs me out of Zoom and I don't know why. It done it to me twice already.
That's so weird.
I don't know if it's only me but I just wanted to let you know I can't the
Okay.
the template.
Okay. I can email it to Dr. Vance too. Let me see here. That's so strange you're getting logged out. Let me see here.
Okay, is it just us here in the main
Yeah.
room? Just really quick. Oh, does it? Let me pause the recording.
Okay, there we go. All right. So when we think about them, I don't know what keywords you came up with or synonyms, but again, sometimes you come up with, they end up being phrases. And while you do get two, I did, provide 2 lines of the synonyms. Sometimes you have more, sometimes you have less. So some ones that I pulled out are chronic.
Were you sharing your screen?
Oh my gosh, I am not. Thank you so
Okay,
much.
that's all right.
I was like, everything's going fine. All right, so now you can see. So I came up with a list of synonyms and keywords, kind of based on that question. And so for long-term diazepine use, I came up with chronic diazepine, benzodiazepine use, or high-risk medication. So it doesn't always necessarily need to be about, it can relate to that original, keyword or key phrase. For population, if you put in the phrase adults over 65, the database is not really gonna be able to translate that. They always get real weird. So you could try it certainly, but seniors or geriatric are better terms to use. For the change, since we have evidence-based strategies, you could use that. But also I was like, what are some actual, strategies that have worked, as we're thinking about our, what the evidence says in our searching question. And that came up with medication discontinuation and provider education. And then for improved medication safety, I just shortened it to medication safety and then adverse drug events. And so that's kind of what I had come up with, what I had thought about. for this question. So as we move on, we're going to move on to Boolean phrases and searching. As it says, it's fun, it's frustrating, it's confusing, it's an art form. It's something that you'll have to maybe try 2 or 3 times before you get it right. I have to do that all the time. It's normal. It's kind of, just a hit or miss type of thing for a little bit. So one of the phrases that I like to use, and I'm going to show you how to do this in CINAHL. So if we go to the library website, I'm going to show you this. And then I need to just pull up slides over here. Let me see here. Sorry, guys. Just need to pull this up over in a separate area so I can make sure that I have all my notes. All right, if we go to databases and you're like, I need to look at a database, you can either put the database name in by here, or you can go to subject. I like to go by subject and then scroll down. This is just databases by titles. I click that all the time and it never works. You can either go to health sciences or you can go to nursing. Okay, Access Med. We do have, I just want to highlight real quick this new database we have called Access Medicine. It's got a lot of good study materials on it, books, things like that. It has case studies, for anything, you might need that for. So definitely, check that out. Not today, because we're not going to work on that for this, but for when we're looking for, our evidence, we're going to go to CINAHL Complete up here in our nursing databases. And then, so when we talk about phrases, right, like medication safety, when we type in medication safety, what returns is we get a lot of results, right? 23,000. And that's because it's looking, as you can see, at medication and safety separately. It may also look at it together, like with this result, but for the most part, it's going to give you either medication or safety or medication safety. So when you have a phrase like that, it's best to put it in quotation marks. When you put it in quotation marks, all you're going to get is everything in the database that has to do with medication safety altogether in that phrase. And that brings it down to about 2,200 results, which is really helpful, especially as you're searching and you're like, why is this giving me a bajillion results? Sometimes it's just doing that little thing of adding your quotation marks. So then the next thing, what we're going to do is talk about, we're going to move on to Boolean phrases. So what Boolean phrases are these terms, they're and an or not. And what they do is they kind of work with the database to let the database know that when you're using and or not in capital letters and all caps, it tells the database essentially that you are looking for 2 terms or 2 phrases together. So if you were to type in medication safety and seniors, with the and just like this, you're going to go ahead and get 32 results, which, is maybe not a lot, but that's only part of our question. So keep that in mind. That's kind of how we use and like when we're talking about Boolean phrases.
I have
The
a quick
other
question.
Boolean, oh, sorry, go ahead.
Sorry. Does it make a difference if it's all in all caps or not?
It will. So and databases are getting smarter at this, but if you were to just put and, what it's going to do is, so this one's smarter, it's obviously getting smarter. It still gives you 32, but there are certain databases that do not pick this up. So if you were to put medication safety and seniors, what it's going to do is search medication safety, and it's also going to search the word and then it's also going to search the word seniors. So I like to remind everyone, just because it works in CINAHL doesn't mean it's going to necessarily work in another database. So that's why you always want to use that with the and, with the capitalization. And then if we look at, does anyone have any other questions about and right now? No, okay. So now we're going to look at or. So, and when we talk about ands is when you're going to use this to combine different areas, different components of your question. So if you're looking for example, that's when you combine your medication safety and seniors, right? It's where you combine those two areas together. But you're like, I have a lot of different, words for seniors. What you want to do is you want to use or. So if you're looking for synonyms like terms together, you're going to put seniors or geriatric. And my spelling's not the best, so sometimes when it comes back, I won't know that it is wrong until the spelling comes back. So when we look at seniors or geriatrics, what we're going to get is 89,000 results, which is a lot. That's okay. We can, we're going to be able to narrow that down. And so that is kind of using or. When you use not, it can be very tricky. So I try not to use not unless it's something like very, like if the term means two different things, right? So if you're looking for kind of, things related to nursing, you could put nursing not profession or nursing not breastfeeding, depending on what you're looking at, because you're going to get a lot of because if you just use like nursing, depending on the rest of your search, you're going to get all of that other information that may not be relevant. So it's really good for weeding out information that isn't necessarily going to be related to your topic. I don't use it very often unless it is something like nursing is very I'm just getting a lot of the kind of results for both things. So don't worry about using not a lot. Does anyone have any questions up till now? Okay, so the next
I do have a question. Sorry.
no, go ahead, go ahead.
What's the difference between using, like, how do you know when it's better to use the quotations versus not using it, or do you just figure it out as long as like you go and just if it has too much?
Yeah, so the quotation marks, what you're going to do is you'll use them when you have something that is like considered a phrase. So like you're not going to put in necessarily in quotation marks seniors and medication safety or seniors using medication for falling, right? If we put that phrase in, that isn't really going to help us be able to do something. The quotation marks refer to really short phrases, so it would be something like medication use, or it would be, long-term use, something like that. Is that kind of answering the question, or?
Yeah, so you don't have to use it for like single words when you put like this and that.
Yeah, you don't have to use it for
Okay.
single words. Yeah, if it's just like a single word like seniors, you don't have to use it. So it's mainly just for, when you have those, 2 or 3 word phrases. So what we're going to do is, now that we've kind of talked about, what we talked about, medication seniors and medication safety and seniors, right? So we have our seniors or geriatrics. And then we want to add in our medication safety, right? So if we add in our medication safety to this, just like this, without any of our without our parentheses, what we're going to get is 29,000 results. And that's because when you are using or as your Boolean phrase, and you need to kind of break up your because when you're using those synonyms with the Boolean phrases, you want them to kind of search all of that one particular area all at once and just that particular phrase, like those words or phrases. You don't want them to combine with the other like terms unless you have parentheses around them. Because adding the parentheses, what this does, it tells the database, okay, you're going to look at the terms medication or seniors or geriatrics separately. And then you're going to look at it how it relates to medication safety. So when we do that, it brings our results down to 71, which is good. So when you're doing that search and you have kind of all your like terms together and you're wanting to kind of break this up and search by your, like terms, you're going to want to use those parentheses around those like terms. So that is another helpful, that's how the really kind of basic use of parentheses and kind of these, building that search string. And when I mean search string, that refers to what you're searching. So it refers to your search terms all together in one piece. So this would be considered your search string. And then there's one or two more I want to show you. So if you have a word like, let's see here. If you have a word like strategies, right? If you're using that word, you could have a lot of different endings. So you could have strategies or strategy or strategic. Or I don't know, maybe strategery will work. I can't tell if that is a made up word that I've been using for years or if it's an actual word at this point. So this is a lot, right? This is a lot. It's going to make your search look really messy when you're searching. So instead of putting all of this in, what you can do is you can go ahead and you can just put in strat. You're going to take, and you can do this with most words. You can take the root part of the word. So you can start, if you take strategies, or you could take strat, you could even take this part. And then if you put the little star symbol up there, what this does is it truncates the word. So you're just using the root, and then it adds the different endings all to it together. So it'll search all of that without you having to put in all those different terms. So that is another thing that you can do when you're searching and there's like a bajillion different endings and you're like, I don't want to write all of these. You can just put that in. And this typically works across most databases at this point. If you're ever unsure about it not working in a database, you can always reach out and I can kind of show you where you can find out if that works. And then there is one more, and I don't really use this one a ton, but for example, if you're concerned about different spellings, like the British spelling or the English spelling, instead of typing out woman or woman or any of those, what you can do is you can just put WOM, and then you can either, some databases use a question mark, others use an exclamation mark. You go ahead and you press that, and then it gives you kind of all the different woman or woman. So that'll give you that as well. Does anyone have any questions or anything right now? Okay. So now what we're going to do is we're going to go over how we would put this all together. So what I want to do is I'm going to go to advanced search and do this because I think it will be a little easier. And then also, before we kind of put this all together for our final string, I just want to go over this real quick. What you can do is there is a filter, and this may come in handy later, where you can just look at, if you're looking specifically for nursing interventions, there's no nursing intervention button filter, but you can use this randomized control trials, and that will get you your nursing interventions. This evidence-based practice one is more about giving you those guidelines. So it's not necessarily going to be super helpful for your research. So it used to have I don't like this new search thing that they have. It makes it, I'm not a fan. So what you want to do is you can either do it in here. So we'll do it in here to kind of show how it breaks up. We go geriatric or seniors. And I'm already forgetting seniors. And then I'm just going to copy and paste this in here. I think that'll be a little easier. And then kind of go ahead and we're going to just build this out from here. So this is kind of all of the areas that I had been, oh no, this is the full one. So these are kind of all of our different areas of our search, right? Those 4 areas. So, and sometimes you may not necessarily have all 4, that's fine, but most of the time you'll have all four. And then when you go ahead and search this, you put it all together. It's going to say no result. I don't know why that's not working this time. That's why I never use that part because I just like to go ahead and put it all in at once. But I wanted you to see what it looked like broken down. So when you kind of put it all in like this, it's just one line, but it puts it in. We're going to go ahead and we're going to search this. Okay, and we're getting 4 results. So again, that's not a ton. This was my first go round on looking for, looking for things. And that is okay. Like, obviously, there's some issues in my search. I probably need to take away some terms or maybe add some. That doesn't necessarily mean that it's going to be terrible. We'll figure it out. So keep that in mind. It's really just kind of depends on, we're getting our first searching, we're kind of figuring it out. Sometimes once I get that first search in, what I'll do is I'll go ahead and I'm like, I need more keywords. I don't know what to use. I'll go in and then I'll go ahead and I'll look and see what their subjects are. If they have any keywords, I'll go ahead and I'll try to use some of those keywords. And if they don't have them, you can oftentimes find out that their major subjects will end up being kind of what those keywords could be. So does that all kind of make sense to everyone?
Ashley, can I pipe
Yeah.
in for a second?
Yeah, go
Will you
ahead.
bring up your other screen that you were just on?
Yes.
Okay, so and then if you'll just go back out of that one particular
Oh.
article. Okay, so you guys will have an evidence search strategy to turn in here in a little bit. And you're going to be using your own PPCO questions. And so last week, I think I first uploaded the small group exercise as my example template, which you guys should have released to you that you can see that you're going to have to fill out for the work that you're going to be doing. That has your group's PPCO question. Do you know what I'm talking about? Shake your heads if you do. I see head shaking. Okay, good. And so you see that Ashley was telling you that there is the search string. So what you would do on your evidence search table is first off, the database that she's using, somebody tell me what database it is.
CINAHL Complete.
Yes, thank you. I want nobody to write on there EBSCOhost because you're not searching EBSCOhost. EBSCOhost is kind of like a search engine of databases. So if you look, Ashley, will you point to them where it tells where they're searching?
Mhm.
Will you click on that?
Yeah.
And so now EBSCO will allow you to search multiple different databases. And so you can see in here all of the different databases that are available to you. So if you were doing a psychiatric, let's say you have your patients are coming in and they have like something with depression, then like instead of searching CINAHL, which I would definitely search because it's the cumulative index of nursing allied health literature, you might select APA Psych articles or APA Psych info as your database. One of the things that I don't recommend, and Ashley, please feel free to just correct me because I am not a librarian, but I do so do a lot of searching, is that I don't combine databases. And the reason is because it increases the number of duplicate articles that you get. And so I think it's obviously unreasonable to go through 89,000 articles. So we're going to show you some ways so you can filter that down. However, if you get 200 article titles, I mean, I think you could fairly quickly screen through article titles to determine if they're relevant for your PPCO searching question. But if you've selected 2 databases, there might be 50 of those that are duplicate that you're looking at twice and you're like, oh gosh, did I see that one already? So what I'm saying is only search one database at a time in EBSCO. I think for the most part in this class, the main databases that you're going to be using is going to be CINAHL and PubMed, and you might search Cochrane Library or something like that if there's a guideline. Ashley, will you go back one? So, okay, you all know which database that you're searching. What database are you not allowed to use in this class? Does anybody know?
EBSCOhost.
Oh, okay, right. You're using EBSCOhost, but it's not a database. Thank you. But what freely accessible search engine do I not want you to use in this class?
ChatGPT.
Okay, well, we are going to do some ChatGPT exercises, but they won't give you but not for searching literature because it won't give that will not be accurate and it makes crap up. But somebody else said it, I think. Yes, don't use Google Scholar. And the reason why I don't want you to use Google Scholar is one, because all of you have free access to this library. And for the most part in CINAHL, if something is indexed in CINAHL or Scopus, it's going to be peer reviewed and it's going to be not in a predatory journal. If you search on Google Scholar, when you find an article on Google Scholar, you're going to have to then look up that journal to make sure it's not a predatory journal. Does anybody know what a predatory journal is? Okay, well,
It's
if
okay.
nobody's.
We're gonna go over a
Oh,
little bit
you
about
are?
that
Okay,
later.
perfect.
So yeah.
Well, so we don't want articles from predatory journals. So that was the point of that. So I only want you to be using the databases for Health Sciences Library. I also don't want you to ever put on a filter that says peer reviewed. I'm sorry, no, I want you to put on the filter for peer reviewed is fine. The filter for full text available, because unless you're doing it the night before an assignment is due, we have the interlibrary loan, and if you submit the request for that particular journal article, you'll usually have it within 24 hours. So if you select full text only, then that means you could be missing a really important article for your literature review. Is everybody following me on that? Do you understand what I'm saying? Okay. So when you're filling out that table, I want you to put in that you what today's date or whatever, whenever you searched it, the database that you put in there, and then you copy that entire search string. And then you put that in there. So I know how you searched. And if I wanted to replicate your search, then I'm going to be able to copy that same search string and I should get the exact same thing that you got. So in this one, we got 4 articles. So the next thing, you're going to write 4 articles. You're going to look through these article titles at least and say like, let's just quickly, our PPCO question, if I can just remind you really quickly, and Ashley, if I'm taking a bit too much of your time, just
No.
tell me be quiet.
Okay.
When long-term benzodiazepine use is identified as a safety concern among patients 65 and older in primary care, what evidence-based practice changes or strategies are effective in reducing the long-term benzodiazepine use and improving medication safety, right?
Mhm.
So these are the 4 articles that we found. The first one, the title says what? Interventions to reduce high-risk medication use in the geriatric population. Okay. Do we think that that one might be an okay, yes or no? Maybe. So what I might do on this one is I might actually click on it and look at the abstract or like the show more background, either one.
Mhm.
We can look at the abstract.
There we
Maybe,
go.
oh, there it is. And then we might like look through and see if there's anything in here, what they say about high risk medications. This is the Quality Improvement Project, 3 months, blah, 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 with one or more high risk medication. So I right now from looking at that, I can't tell, but at this moment, I would go ahead and I would select that as one of my potential articles. So then, Ashley, if you'll go back,
Mhm.
we only have 4 to go through. So, um, an interprofessional approach to reducing the risk of falls through enhanced collaborative practice. Does that sound like it answers our PICO question? Not at all. Nope. Okay, evidence-based strategy for optimization of pharmacotherapy in older people. Okay, maybe. Frailty in older adults, assessment, support, and treatment implications in patients with cancer. Probably too narrow, right?
Mhm.
So you would put in your search that you had 4 and that you eliminated 2, right? Because I think we decided we were going to keep 2 and we're eliminating 2. So those are 2 articles that you're going to include, that you're going to pull and actually review to see if you're going to save it for your project or not. Is everybody kind of following this process, what I'm saying? One other thing, if I don't know, actually, if you're getting ready to switch to a different database or something like that, will you show them how to that they can log in and create an account and save their searches?
Oh yeah, absolutely. So when you go to the library, what you want to do is you want to go to My EBSCO and sign in. I'm really bad about signing in, which is to my detriment. But if you sign in, um, it'll have you create an account. I think you just use your WVU information, and then you'll have to, as you're, even just getting on to CINAHL, you have to make sure you use your Okta. I don't think you have to use Okta for the EBSCO login, which is nice. But then if you go to projects, you can create a project, or you can go to your saved searches. So sometimes I like to save them or save articles. And then it has a recent activity. So it'll kind of review all of your different searches from earlier in the day. So, and also just because it's your account, it'll save your most recent 40 searches.
So that way, if you forget to copy and paste something, when you're doing your assignment, you can be like, oh man, if I was signed into this, I would have all the searches that I just did. So I could put this in. So when Billy checks it, she'll be able to like put in my same code. So just, I'm trying to share these things with you to make your lives easier.
Yeah, absolutely. Thank you. Okay, so now we're going to go talk about controlled vocabulary. So let's see here. We talk about controlled vocabulary. It's kind of a set terms by database that kind of organize and categorize articles based on what their content is. Sometimes this works, sometimes it doesn't, and the content is not, that might not be the best word. So keep that, or, the best controlled term for that article. So keep that in mind. It does kind of happen sometimes. So how would you describe this can of soda? Like, what would you call it?
A cylinder?
Yeah, you call it a cylinder. You call it Coke. You could call it soda. You call it pop. Like, there's different, everyone's got like different terms, right? But when you talk about what exact, like how, like what the classification is, what you would consider controlled vocabulary, it would be is a Coca-Cola can, because it is branded as a Coca-Cola can. So when we talk about controlled vocabulary, what this means is it's a language of database. It's the language of the databases. So it's going to help make your search more efficient. It's takes your preferred terms and ties synonyms together. So it kind of works with different variants. So if if you're using multiple phrases, multiple terms for something, it's just going to have it's just one term. It's not like synonyms where you're going to have 5 million different versions. Some databases will, they'll be under the thesaurus or headings sections in PubMed, which we'll also go over. They have their own special set of vocabulary, which are called mesh terms, and those are medical subject headings. And we'll get into those, but essentially every article in PubMed gets assigned one of these terms. And you want to use these both controlled vocabulary terms with your keywords, because sometimes the articles may not have keywords with them. So, I was working with a student today. The articles she found so far did not provide a list of keywords. But they did have, because they are in those databases, have those controlled vocabulary terms. So you can kind of work backwards and make your keywords based off of what those controlled vocabulary terms are. So that's why when you're doing your search, you always want to have both, because sometimes one will have one and not the other, and vice versa, and people use different terms. So when we're in CINAHL and we want to look at controlled vocabulary, what we're going to do is we're going to go to the CINAHL headings area over here. And what I like to do is I'm going to pull the sheet back up on here. And I'm not sure what exactly yours looks like, but when I have my keywords, then I have my CINAHL subject headings and then my mesh terms. And what I like to do is once I have my keywords, then I start on my subject heading terms. And so what I'll do is I'll see, does X keyword have a X subject heading? Sometimes they do and sometimes they don't. So if we look at this, I want to see the example. Okay, let's go back to our question real quick. Oh no, it's not showing up. There we go. Don't know why that's not working. Okay. So if we were to look at benzodiazepine use as a term, right? What we can do is we'll go ahead and we'll search that in the in the headings box. And then we'll put in benzodiazepine use. And then what'll happen is if it is a term, it will show up. It may be the first one. It may be further down on this list. But what it does is it shows you the term. And then if you click on it, it'll give you what it's used for, the definition, and then it shows you where it fits in a tree. So these are kind of called the trees. So it is kind of works with it's an anti-anxiety agent. And then it kind of, this is going to be more narrow and this is going to be more broad. So these are just different other types of, diazepine or different agents. So if we go ahead, we can look also, you can go ahead and explode it and it'll show you the different kind of, you can restrict it even more if you want to. I tend not to do this. I find that it kind of really makes it more difficult to complete my search. But what you can do is you can search the major concept and then you can add it to your search. And then I like to put it in here so that way there I do know what that means. Or you can go ahead. I like to also just, because that is the major term, I like to just add this kind of regular add to search to show up. There we go. And then what I do is I'll put that term just the way it is, because sometimes I'll forget the MH and then how it's supposed to be in there. And then I'll add that to my template and then put that in there. Okay. Oh, it's because I have not enabled editing. But that's kind of how that works. So it is going to look different. These headings will look different from your regular search. And that is because this is how it looks like in that controlled database. So that way there, when you see it come up as one of those associated terms in the article, that's kind of how it's going to look. So that is what it looks like in CINAHL. I'm going to go ahead and kind of just go over some of these slides. Okay. So then again, this is kind of some of the other ones that I found for searching this with our question, what it looks like when you have your keywords and then when your subject headings. So now we're going to kind of go over and look at PubMed. So PubMed is a different database. PubMed, and another reason why you want to always search your databases separately, even in EBSCO, is because you won't be able to tell what database it's coming from, but also because not all databases are going to give you a full text, which is why you don't also want to press that full text button, because like PubMed it's really a database of it's like an index of articles. So it's not going to have necessarily every article associated that's in PubMed. It's just going to have the abstract and some other information. So we go to PubMed, we're going to get this kind of very nondescript looking website, and we're going to go to mesh database. This is where the mesh terms live, the controlled vocabulary for PubMed. So if we were to look at medication safety in here, it's not found. Not every term you search is going to have a mesh term, and that's okay. But you're like, maybe there's a different way to phrase that. So maybe we could try medication. So if we look at medication, we see that there are a bunch of different subject headings associated. And what I like to do is you'll get a little, unless you like hit it like right, like nail on the head and you get the right term off the bat, you're going to get this list and it'll always give you the definition. So for example, if we wanted to look at maybe medication therapy management, we can go ahead and look at this one. Oh, that's good. I thought it was down again. And then what you'll do is you'll see this definition, you'll see the subheadings. So these are kind of major and minor terms that are associated. You'll see what the entry terms look like, how it's going to be put into PubMed. So if you put in any of these, kind of the way you enter it this way, it's going to show up. And then it also shows you the entry term or the tree, which is how you're going to know if it fits in your category. Because this definition might look great. It might look, you're not scrolling all the way to the bottom and you're seeing pharmaceutical, Medicare, that's not really relevant. But if we scroll down, patient care management, maybe that does actually end up working. So then you're like, okay, I can use this as one of my mesh terms. And I'd go ahead and I'd add that in there. Sometimes if I'm just kind of playing around, I'll add it to the search builder just so I can see what it looks like. It does have these quotes. You don't have to necessarily have those quotes. So now that I'm going to copy this over real quick though. All right, so now we're going to go back to PubMed And PubMed you can access without having to go through the library database, but you probably will not be able to access most of the articles unless you go through the library website. So keep that in mind. And then when we're searching mesh, I like to, anytime I search in PubMed, I like to go to advanced, and then I like to go to the search history. And then I can look as I'm searching rather than kind of breaking this up and having it be really annoying the other way. So when you add in your mesh terms, you don't need the quotation marks. You're just going to add that and then add to history. And then it's going to show you everything, which is great. And then if you look at the details, it's going to show you how it translated. So PubMed does this thing called automatic term mapping, which is nice and also really annoying at times. Because if you're looking at something, it can really affect your results. So if, for example, if we're looking at standardization and we're just we type in standardization into PubMed, what it's doing is in the back, it does this thing called, this is what automatic term mapping does. It takes a term and then kind of relates it to all these other terms. It can relate it to all these other terms and also all the mesh terms associated with that term. So we see here standardization, it kind of changes it to standardizes, standards, all of these, also all of the mesh terms. But if we put it into our TIAB, which is another part of PubMed, which will be really helpful and will also be on the slides because I know this is a lot. If we add this TIAB, that means title and abstract. What that does is it just looks at that one phrase in title and abstract. So you can cut that down. And this will be really helpful, especially if you have a term that is, not really, it's a more common term, things like that. Something that you'll notice over here, I was doing a search earlier and we have core temperature, for example, not putting in, you don't necessarily have to put it in quotes in PubMed because it will do this automatic term mapping. So if you put it in quotes, it kind of cuts down on some of the things you might actually want back. So I like to sometimes just leave it like that. But as you can see, when it translates it, it changes it, takes out, it's just looking at temperature and core once. So keep that in mind. Does anyone have any questions about any of that so far? No, okay. And I know it's a lot of information. It'll kind of, once you kind of start working with it, it'll kind of make sense. So this is what I have for your, let me see here. This is kind of what I came up with for the controlled vocabulary for PubMed. So we have, I came up with benzodiazepines and then patient medication knowledge, medication therapy management. And again, this could change depending on who's doing the search. And then, so like if I wanted to kind of use this as a search, I'm going to pull this out so that we can kind of do an example real quick. Okay, that. And then we go back to PubMed. What I like to do, especially in PubMed, because of the way it builds things out, I will typically just put in all one word at a time and then combine them. Because when you do press these like little add to query, what it does is it'll build it up in here for you. So you don't necessarily have to work with that. So just an example. See, and sometimes it's not going to work. But so if we're using, let's say long-term. No, that's incorrect. Use, and then I kind of want to, this is just an example. So if nothing comes back, that's totally fine. But this is kind of how you would put it in if you were searching with those terms. Benzo, nope. And then you would put in mesh. All right, and then what you'll do is when you add it to history, it's going to come back with 72,000. So then, that's a lot. So obviously, you'd want to go through and kind of look for more terms. But similar to like when we saw in EBSCO, it has the terms come up in here. If there aren't keywords associated, what you can do is you can go down and you can kind of see what these mesh terms are and see what ones they're using, and then be like, okay, these are some mesh terms I might add to my project. So does anyone have any questions about any of that? Okay, and then there's one, so let me go Polyglot Accelerator. Okay, so there's a tool called the Polyglot Accelerator, and this tool is incredibly helpful because what it's going to do is it's going to take your search, and this is why when I start building my searches, I like to start them in PubMed because makes it a little easier. But I like to, so what I'll do is I'll go ahead, I'll take my recent activity, just as an example. And then I'm going to go ahead and I'm going to copy this, or no, I need to actually copy the text. And then you can put it into this polyglot. And then what it'll do is it'll translate it across every database. So that way there, it'll show you what it looks like. So instead of having to kind of learn the translating between these, CINAHL subject headings and mesh terms and all of that, you can put it in the polyglot tool, and then what happens is it will translate it. So for example, if I go back to the search that I had earlier in here, let me go to advanced. Okay, this one, yeah, this is a good one. So if I were to go ahead and take this search and put it in this polyglot tool, right? It's got all the mesh terms, and this is why I like to start in PubMed. It'll tell me what it says in PubMed, obviously, but then when I go down to CINAHL, which will be when you'll need, it'll translate. So you'll be like, oh, this is what, title abstract means in CINAHL, and this is what, major heading means, it'll tells you how to put those in. So you don't have to do all that translating yourself because it is tiring and very hard and difficult to be able to do all of that there correctly. So I like to use this tool, and I'll be sending that out to you as well.
Is that free, and do they have to get access to it? Because that's
Nope,
fabulous. I didn't know about Polyglot.
It is a free tool. So this used to be part of a larger systematic review tool that was online, but they have taken that tool down and changed it. But because so many people use this Polyglot Accelerator, they've kept this up. And to my knowledge, there's no time, or there's no plan to take it down. So this is a really good tool to use. So I use it anytime I have to do searching.
That's fabulous.
Okay, so what we want to do is, because I'm sure
I have a quick question.
Oh yeah, go ahead.
So with this polyglot tool, would it be like a good place to start since it's going to give like each different database like searching? Like could we start here and then use it to search at PubMed and CINAHL?
Yeah, so that's a really good question. It's not a good tool to start in though, because it's not going to tell you any of the results or anything like that. It's just going to give you all the terms. So what you want to do is you want to pick a database to start in, and that could either be CINAHL or PubMed. I usually start in PubMed, just because it does a better job of translating those mesh terms to the subject headings than it does translating the subject headings from CINAHL into mesh terms. So what I like to do is I like to start here so I kind of have an idea, and plus starting in PubMed or just any other database, I kind of know how many results I'm getting. So, because you want to build this search in here and then translate it and then find out that you're only getting 5 results, or 4 results like we did earlier. So, but you also don't want to get stuck, with 72,000 results, because if PubMed has 72,000, this could be double in another database. So what you want to do is you kind of want to build it in one, and then once you're comfortable with that search and you feel like you have a lot of good terms, like I would say 1,300 is still kind of a lot, but it's an acceptable number for me as I'm kind of starting off my search. I would take this search and then put it in the polyglot tool after. So just to make sure that I'm comfortable, I have a search that I like before I build it in there. Because yeah, you won't be able to tell how many results you're getting. And I've met people that have done it backwards, and it's very they somehow end up more confused. So definitely don't do that.
So which database do you start with?
I usually start with PubMed,
Okay.
just because I find it easier to do the translating tool. But CINAHL is also totally fine to start with too, if you're more comfortable with that too. You might just have
Okay.
to do a little bit more kind of digging for those subject headings. So, all right. Where did I put my slides? Oh my goodness. Let's see here. Did I somehow close them? It is entirely possible. Okay, just bear with me for 1 second. Does anyone have any other questions or anything? Not opening.
Can you send these slides out so we can refer to these later?
Of course, yeah, I'll definitely send these out to you. You'll get a copy of them. I'll send them to Dr. Vance and then she'll send them out to everyone. So yeah, you'll have a copy of them. And then if we update anything or talk about anything, then I'll make sure to add those as well. So because I think I forgot to add the polyglot tool to this. So let me do that real quick. Make a note. Sorry about that. I don't know what's going on with my computer today. It's just all over the place. Okay. So for the sake of time, I'm going to go ahead and skip over the group activity, but there's a couple other searching techniques that I wanted to kind of go over with you. So sometimes when we only get those 4 results, that can be very, it's defeating. You're like, this is not working. Sometimes they'll happen a lot. And then you'll be like, I need more help. So what you want to do is you can do this thing called backwards and forward searching. And what this is, and it's especially incredible if you're looking at systematic reviews or meta-analysis, things like that, because those, depending on the class, professors prefer you to use them. Some prefer you to go through and find the actual articles in the systematic review. So what you want to do is you kind of want to take and now they have, not all articles do this, but they do have this 4 citations in Scopus thing. I'm going to show you how to do this in Scopus because I think it'll be more just in case you're on a database that doesn't do this. So if we go to Scopus and then it'll load eventually. Okay, perfect. So what we'll do is we're going to go ahead. We really like this article. We want to use it, but we're having trouble finding more like it. What you can do is you can take the name of this article and you can put it into Scopus and then search it. And this will work with most articles. What you can do is it'll say 33 documents found. What you want to do is kind of go in and try to find the actual article that we used. Let's see here. Okay, 4 citations. Interventions to reduce. Okay, if someone sees it, please yell it out because I'm terrible sometimes at finding these. Okay. Oh, is that? No. Okay. I'm going to put in quotation marks. Sometimes that helps. I did do this earlier today and did not have any problems. So now I'm just very feeling the heat right now. Okay, so we found the article. Now what you want to do is if you like this article, one way you can backward search is by looking at the references and saying, okay, what did they cite in their what did they cite in this article? Who are they citing? So you can go ahead and kind of look at these and see, okay, these are the important, these are articles. I want to look at one of these, some of these have really high citations. That might be something that you want to kind of look at, right? This number 9, this review. So you can go ahead, add that one to your, add that one. You'll be able to kind of see what the keywords are, what the index key, what they call them entries. Those are their subject headings. So it kind of lets you see all of this information. If you're like, this is a great article, is anyone citing it? You can also be like, oh, I want to cite, this article from here. So, there's different ways to search. So if you search, if you want to look at someone who cited especially if it's an older article, like an article from what year is it? 2025, 2026. So if you want to look at an article from 2006, right, that might be maybe not the best evidence. There might be newer evidence. What you can do is you can go ahead, look at that article and see if anyone's citing it. And then you can go ahead and kind of see if there's any newer research coming out of that one article to see if that is helpful. So that is another way to search. And then there's also, you can search by author here. So if you are interested in, let's see here, who's one of these authors? If you're interested in this Nathan Stuckey guy, what you can do is you can go to Scopus, and then you can go to authors, and then you can go ahead and put their names in. Make sure I'm spelling this right. Nathan. It doesn't always work the best if they have initials in their first name. You may have to actually go and try to figure out who that person is first, which is a bit annoying. But what'll happen is hopefully you'll get lucky, and then you'll find these, if there's only 2 of them. Sometimes people, depending on how well they keep up with their, naming or like how they publish their work, they could have multiple entries. That's why some people are like to keep everything the same, keep their beta names, just because it makes it easier when you're doing these types of searches. They may just like to keep all their research under the same. So when you look at this, you can see, okay, maybe this is the guy. How many does he have? He has 2 articles in here, and then you can also kind of see what their impact is and what their articles are as well. So that's definitely another way to search if you're like, I really like this one author and I want to know more about what they're doing. So keep that in mind. Okay. So
Actually, I have a question about that, actually. If they were describing that in a search strategy, so like did you start I missed the first part because I sent the polyglot link to everybody and put it in Soul. But did you start that with your keywords, like your original search in Scopus?
Yeah, so
'Cause I missed that.
oh no, when I do this search, what I'm doing is I'm doing backward. I'm like using they call citation trail. So I'm using forward searching and backward searching to find these articles. So it's a little more tricky to document because you are technically using those terms, but it might be an article that you find from another article. It's using
So that's
like
what I
using
was
the
wondering, like if
references.
they were describing using like the citation search and forward to backward searching, so is that how they would articulate that? Like, because they wouldn't necessarily go into Scopus and put in keywords, but if they were in CINAHL, found an article, and then like from a selected article, they used forward searching and backward searching in Scopus.
Mhm.
Is that how they would describe it?
Yep, that's exactly how you would describe it. Yeah.
Okay.
Right, that's a good question. All right. So we've gone over that. All right, so now we're just gonna go over the next part a little quick, and then let's see here. Slideshow from current slide. So there's different levels of evidence within your evidence searching, right? So when we talk about levels of evidence, we're talking mostly about this pyramid. Not all evidence is created equal. Depending on what you're using, that information is going to be better than others. When you're looking at information, you also need to examine the quality of that evidence. And basically, things that start off here at the very, very bottom, these are going to be kind of your studies. They're going to be your case reports. There's a lot more of these going on than there are systematic reviews and meta-analysis and randomized control trials, because these require less work on the kind of upstartness sometimes. So what you're going to do is you're going to see a lot of these. This is where a lot of your evidence is going to come from. And then when you get up here, up to more of these things after kind of, even in your randomized control trials, but some of these meta-analysis and systematic reviews, what these do are kind of looking at all of these the bottom of the pyramid and saying, these are the best articles for this particular type of intervention, or this is the best evidence for this type of, treatment plan. So that's kind of what this is referring to. And I'm sure Dr. Vance will go into more detail at some point, but this is kind of what, when we talk about the evidence pyramid, this is what we're looking for. So when you're kind of like at the bottom, it's still quality, but when you get higher up, you're gonna, it's kind of like you're looking at reviews of reviews, or you're looking at articles about articles. So it's kind of a very more, this process is very rigid up here. You have to, have like, if you're, for example, when you're doing your search, you have to have one search only, and that search has to be the same. You have to be able to find all your articles within that search. You can't have 4 or 5 different searches or 2 or 3. So keep that in mind when you're doing this lower kind of, evidence searching. If you end up, I can find all my articles if I do these 2 searches. That is okay. You're not doing this like very kind of in-depth process where you're looking for like the 10 most qualifying articles for a particular very specific topic. So keep that in mind. But the nice thing is, because the librarians and the people that do all these systematic reviews and meta-analysis have these really intense way of searching. So a lot of the techniques that we kind of use today, like with the, the spreadsheets and things like that, that is partially because their way of searching makes it actually easier to kind of implement in the lower levels of searching when you're just, when you're searching for your PICO questions or your PPCO. Does that make sense to everyone? Okay, I just want to make sure. I know sometimes it can be a little confusing. So when you're looking at, your evidence and things like that, you want to consider, what you want to put in and what you want to put out and what you want to limit. So when you're considering what you want to put in there, that is your inclusion criteria. That's going to be your study design types, who's going to participate, what outcomes are you looking for from your studies. Your exclusion is going to be pretty much the opposite of your inclusion. It's going to be things you don't want to look at. Is this going to be relevant? Get it out of there. I don't want to have it. These are different from your limiters and your filters. So these are really, your filters are really for, if you want to have it within a certain date range, or if you're like, I want to look at only, journal articles from 2 or 3 journals, or I'm looking at, language, like I just want to look at articles that are in English, or if English isn't your first language, you could use articles that are only in Spanish. Like that is really, those filters you see in the databases, those aren't necessarily things that are going to be in your inclusion and exclusion criteria. And then this is kind of just an example of what that, can look like. Again, I'm sure you'll have more detail on this. We've talked about interlibrary loan a little bit. So when you go to interlibrary loan on the website, it's also known as ILLiad or ILL. A lot of your articles that you're using are probably going to be ILL. You do not have to pay for it. It is a free service. I seriously doubt I don't know if anyone has ever hit the limit. It's thousands per semester, and I think it resets every semester. But when you have an article you want that's an ILL, you'll probably get this error because Okta loves an error. But you'll be able to log in. We're just going to go back to the slide because I don't know what's happening with Okta. You're going to go ahead and put in, oh, did I not put it on the slide? Okay. You're going to put in, oh, no, it is on the slide. Oh boy. Okay, you're going to put in the title of the journal, the title of the article. You're going to put in the author, the volume, the issue, and the year, any inclusive pages. Sometimes articles these days don't necessarily have a volume or pages associated. You can just put NA for those. You will also have to decide if you want that article in a different language other than English. And then it takes about 24 to 48 hours to get the articles. If you're looking for a book or anything like that, it will take longer. I have gotten articles, depending on the time of the year, I can get them in like 4 hours. And that's not just because I'm a librarian. But you will only have access to them once they come in for 30 days. So it's really important once that article comes in that you go into your account and you download the article. All you have to do is view it and download it. I, for some reason, cannot get into Okta right now. So we're going to just forego me logging in. I don't know what's happening with that. So that's using interlibrary loan. That's going to be really helpful for you. There's another tool called libtd Nomad that is also super helpful. So when you're searching, what'll happen is, when you're in PubMed, I think you can see it on mine, but it'll have this little download PDF. What this is it is an extension for your browser that links to the library catalog so that when you're in a database, or like if you're not logged in, like because I often will not log into PubMed to use it, I will get that I have that little button, and then it tells me you can download the PDF. So then I can just go ahead. It keeps making me request that I'm a human today. But then I can download the article and I'll have access. And the nice thing is also if, it'll tell you if it's an article link. Sometimes it's not just a PDF download. Other times it'll have you access options. This will bring you to the IL page. So then it automatically brings you to ILL, and then you can fill it up. You can fill it in and then request it. And then I usually say yes just because I'm curious, and then press submit request. So that's kind of an easy, really helpful, good tool to use to help you with your research. And then there's some AI things on here just to remember, the environmental costs. So when you are using it, make sure that you are being as succinct as possible with what you're putting into it. So that way it's kind of, you're able to show your work, but also use it less for your prompts. So make sure your prompts are very succinct, and then you'll get your information a little faster. And then there's some helpful AI tools that I like to use. There's Insightful, which what it does is it gathers literature. So if we wanted to put this article into where is it? Over here. We put it in here. It's going to give you a list. I'm just going to click this first one for the example. But what it does is it kind of makes this visualization map matrix of the author of the article, who they're associated with, anyone that they kind of wrote the article with. It's really helpful to kind of see how everyone connects in the literature. And then it'll also help you, it'll show you if there are similar papers that are written on the topic, and then if there's any, most important papers, any review papers, things like that. So this is one tool that's really helpful for when you're kind of searching and you're like, I need some more tools. What I'm doing is not working. There's also Research Rabbit, which is very similar to like using Spotify or another music app. What it does is it essentially it does the same thing except as Insightful, except it lets you save the article within your folders. So that way there you can kind of see, oh yeah, I like this article and I wanted to see kind of how it relates to other articles. You can go ahead and it'll show you all of that. So these are two really helpful tools when you're kind of needing some more help. And then predatory journals. Sometimes when you are, doing work, things like that, I have some examples of getting a predatory email from people. What'll happen is you'll get this email and they'll be like, it's so great to meet you. Let me see. I saved one because I was like, I can show this example in class now. This is a very exciting day. Okay. All right. So I got this email and it'll say like really weird things like calling you a doctor. I'm not a doctor. It'll also bring up an article, like maybe you've like written a book, or not a book, but maybe you've written an article on a topic. Sometimes they try to get you to put your article you've already published in their book, or they'll be like, let's follow up. And it's just weird. Like no one's going to do that. This is not how the process works. It'll probably be over a listserv and someone will be like, please help me with this project. Getting emails like this is usually really just kind of a weird thing, especially like you'll get like 4 different addresses and then it just, this is a good example of, just a predatory email you'll get. Some other things you'll see are you'll see spelling mistakes. You'll get really weird compliments. You're doing well and in good health. The editor will reach out. I don't know any editor that's ever reached out to anyone about writing in their journal. There's also an unsubscribe feature, which is usually like a dead giveaway that it's spam. The names of the articles, especially when you're searching, the name of the articles will be very similar to the actual name of a journal. So one example could be, they want you to publish in the archive of clinical cases. That may not actually, there it is. Yeah, archive of clinical case studies. That's the name of the journal they want you to publish. And you're like, oh, that's a great journal. But really, the name of the journal that you want to look at is, I don't know, the archive of clinical cases. So they have really similar names. And this will also you'll be able to tell when you're reading kind of maybe not the best article or something like that, because the publisher kind of publishes all over the place. They're not necessarily going to be just focused on medicine. They may have multiple, in ways of publishing, or they'll have, again, their names will be really similar. Some other predatory journals, they kind of have bogus websites. They tell you about impact factors, but they're telling you that they're just indexed in PubMed. That doesn't really mean anything. I can index an article in PubMed. So it's one of those things where you just kind of want to be careful about kind of what you're looking at. Sometimes there's a lack of peer review. If you're ever, you see an article and you're like, there's lots of spelling errors, or I've never heard of this journal before, you can go and search the journal, in PubMed, or you can search it in the DOAJ directory. And in those, you can always look up, especially because there are a lot of open access ones. If you see one in here that isn't necessarily going to be a good journal, it'll tell you, or in PubMed. So those are things to keep in mind. And then, they'll have, these are more for if you're, going to publish things, but also, just especially with, the critical appraisal part, which you'll get into later, but making sure that you're kind of looking at some of this information, being like, okay, this journal is relatively new. Sometimes you get good information, what are their what does the study look like? Where are they coming from? All these things. So even though, you're finding articles in PubMed, you do still want to make sure, if anything seems off, go ahead and take that extra step and just kind of see, what the publisher is like, who's, all of those types of things, especially if they're a lot of websites will look like they do from the early 90s, and that is usually a no-go. So keep that in mind. And then just wanted to say thanks before you go. If you have any questions, you can email me, or you can set up an appointment, request a consultation. I'm always happy to meet with you. This mid-October is very quiet today for us, which is good. But yeah, so thank you so much. Does anyone have any other questions or anything? No? Okay. Well, I know it's a lot of information, so if you need to take some time and, reach out in a day or two, or in a week or two, that's fine too. I'm happy to answer questions whenever you have them, or if you're beginning your search, you can always reach out and, I can give you some tips and stuff like that. So thank you so much.
Thank you. Thank you, Ashley, for coming to our class tonight.
Yeah, no problem. Thank you so much. I really appreciate it. All right. All right. Thanks so much. All right, I'm gonna head off then. And thanks again. Have a great night.
Thank you.
Thank you.
Okay. I have, no, Taylor, you're coming up on my screen really big. I don't know why. Is everybody else seeing Taylor, or is it just me?
Just you.
That is so weird. I don't know what view I changed this to. Why don't I want to just touch on just a few things with you guys, but why don't we take a 5-minute break, because that was a whole lot in a very short amount of time. So let's actually come back at 5:45, and then I'll try to just keep my little last bit to 15 minutes, and then I'll open it up for your small group work, okay? That gives you more than that many minutes.
Professor Vance, since you're recording this, are you going to be posting it then? Because I lost connection, so I missed a good bit.
Yes, I can. And I'm sorry, I did not. Sometimes it's hard for me to keep track of like when people are coming in and out of the room and just paying attention to her. So I finally saw your email when I went to look at something
Mm,
else. So I apologize for
that's
not seeing you
okay.
right away. But yes, I will share this with the room. Let me actually pause the recording.
Thank
We're
you.
not recording this. Resume the recording. Um, there's just a couple things that I wanted to go over with you. I really appreciate Ashley coming. She is a huge help. If you needed to do some searching or needed some assistance, please feel free to reach out to her. She does have, I know, I'm pretty sure the student that she was talking about meeting with, because I recognize those search terms as one of my DMP students, who I said, please meet with Ashley to help you find have her help you find some articles. So I know that she does take time and meet with students individually with their searches. Um, what I wanted to talk about, one, is just so you know, like I know she called this a research question. Now she's a medical librarian and they're frequently helping researchers. We're not going to use the term research question because what are we not doing? We're not doing research. Okay. So you want to call it an evidence searching question. Um, the After I want to show you a couple different things. One, how you can use ChatGPT. So I don't want you to use ChatGPT for your next assignment to write your paper or to create a PowerPoint, but I do think that there are ethical ways that you can use ChatGPT. So here is what we're going to do. With the PPCI, I went ahead and put this prompt in because these are some shortcuts that I think you can take, and I think AI is important for us to be using and learning how to use it, but we need to use it ethically, which does not mean writing a self-evaluation of yourself, so or a paper for you. And I will tell you that ChatGPT does create its own out of thin air or cites things that are not from PubMed. It doesn't have access behind paywalls from libraries. So you want to be very cautious. If I say don't use ChatGPT or don't use generative AI, please don't. But I am saying for this, you can. So this is my prompt because you want to be very clear. I tell Chat, I've created the following evidence searching question using problem, population, change, and outcome format. Give it the question that I've written. Please create a table of synonyms for the major concepts. It will be helpful to have a column with mesh headings and one for CINAHL subject headings. And so we'll see what she does. Usually it's very fast, so I don't know what's happening. Actually, let's just stop. Let's do this. Oh, here we go. So this is going to give you some ideas. Now, do I think that you should use all of these? No, I don't, because you're going to be forever and a day searching. But what I would look through and see, like, okay, we know mesh headings, long-term use, chronic use, drug utilization. So like you could take that. And so you're going to copy some of these over into that chart that you're going to use as synonyms. Okay. Um, and then what you could do is say, let's say using, let's see, we'll say, please create a search string for PubMed using the whoops, headings from each concept using some one or more of the mesh headings. So I want it to select from each one. Okay. And so we're going to hit, I think you guys have access to MS 365 Copilot. Do you have access to that through your Gmail? Maybe not.
I do.
Okay.
I don't
So you
really
could
like
use,
it very much, but
I'm not a fan as much as I am of chat, but okay, so it's given me a PubMed search strategy using some of the mesh headings. And so I'm going to copy this code. And just to let you know, this is how I get into the library. I just put in HSC library WVU because that comes up for me in my search engine first time out. You can tell I'm on here a lot. And then I don't typically ever use this databases tab there because the most common ones that I use are right here. So because I just said I wanted to search in PubMed, I'm gonna, oh, of course I've got to sign in. Where's my phone? Oh, good. I'm already signed in. So I just copied that from chat. I'm gonna hit Control V, put a lot of spaces in there, and I'm gonna hit search. That does not make sense. Only one. Uh, let's try this again. Let's try this one. I think it's because there's so many. Mm-hmm. By such. Give me a. Let's try a Senol equivalent. Allied health literature. Oh my gosh. The polyglot I've never used before, but I'm going to start using it. So like that's actually pretty fabulous. So um let's see. Let's try this. So like as there's how many that came up in here? What was I query? 13,948. So not always does chat come up with the kind of search. You can play around with it. You can use it a little bit differently. I did have it create a search term for this. Let me see, where is it at? Nope, not that. Okay. Oh my gosh, I don't know what is happening with my internet tonight, but it is like super, super slow. Um, I want to talk about inclusion and exclusion really quickly. Um, so these are some of the search terms that I ended up combining because I did some of my own searches without ChatGPT. This is one that it came up with for me the other day. So let's try this in here and see what we get. Okay, so this is my I think it copied because it's a I'm sorry, because it's a PDF, it's copying weird symbols, so that's why it's coming up bizarre. Let me see if I have a Word copy of this. I promise you I'm trying to hurry so that you guys can have some time. Let me copy it like this. Without all the weirdo things. Okay, that looks better. And these are the search terms that I have like more customized. Like I went through the synonyms that Chat gave me and I picked out the ones that I thought were actually meaningful. And then I still went through and I read through these articles using inclusion and exclusion criteria. And what I set for myself, remember, whenever you're, nope, that is not that. Okay. So when you're getting ready to do your search, you have to determine, like she mentioned, in advance, what kind of articles that you're looking for. And remember, the articles have to answer the question. And for your next assignment, not the search login strategy, you're going to be just searching really about the problem and the outcome to be able to describe it better. So we would select long-term benzodiazepine use and some kind of outcome related to, in this one, older adults, to be able to kind of get a better idea and give us some background and information about what this general problem is. And then you're going to talk about the local problem, which is the data that you've gotten from your interview, whichever interview you selected. And then that's what's going to be for your, and you come up with your PPCO question. That's for the next assignment. Then for this assignment is using the full PPCO question, and then you're actually searching for interventions to do, strategies, policies, procedures, whatever you want. And this is your evidence searching question. These are, again, we already talked about developing the synonyms or related search terms. The inclusion exclusion criteria is for when I'm looking through the abstracts and the titles, I can determine yes or no if I want it. I want to be very, very clear with you that written within the last 5 years is not an inclusion or exclusion criteria. That is a filter or a limiter. So do not write in there English language or within the last 5 years, because if you look in here, you have filters. And for this particular one, I am going to limit it because I really think you should only be looking at literature for the last 5 years. If you're looking at stuff that's 10 years old, it's really, unless it's a Sentinel work, it's really probably too old to be making a change with it. So we're going to hit past 5 years, which then should bring us down to 11 articles. And then I'm going to use my inclusion exclusion criteria. I want to, it needs to include at least benzodiazepines. I don't really care if it uses opioids in the article, but if it's only talking about opioids related to long-term use, then I don't want the article. If it's about older adults, and I don't really care what setting it's in, if it's conducted outside of the US, I don't want it. I'm going to exclude it. And the reason for that is because outside the US, they use a lot of medications we don't necessarily have approved within the US. And so it starts getting a little bit confusing if it's marketed elsewhere outside the United States. So that's why for this particular one, I'm only looking at that. I didn't really have any inclusion exclusion criteria related to evidence-based strategies of practice. I really am looking, I want to cast my net wide. I wanted to look for outcomes that could be reduced use, it could be reduced falls, reduced cognitive impairment. If it just reports prescribing practices, then it's really not what I'm looking for. So thinking about that inclusion exclusion criteria, I would look through at least, at the very least, each title. So on your evidence table, you're going to put in here, talked about that. I already talked about how I copied my actual search string in here. Published within the last 5 years. Okay, peer-reviewed English language. I got 10 articles. And then I put in here, 7 selected met inclusion criteria. 3 of them were excluded. And then I rate the reasons why I excluded them. And then I created a reference list for all of the ones that I selected out of there. I believe that you guys have to have a minimum of 2, but from your group, you're each at least going to have 2 for your final project, and they cannot be duplicate articles. So having extras will not hurt you, and you only have to critically appraise 2 of them for your assignment. But if you look here, I just now selected the published within the last 5 years. So let me go back and I put on the other filter. I'm selecting peer reviewed and what did I say, English language? And so now I get 10. So that matches. And so The reason why this is important is that if somebody wanted to repeat my search, they could use my same search term, my same filters. I just repeated the same search and I got the exact same number of articles. That's why it has to be systematic so that it's a replicable search. A couple little tips. So we would read through these titles. Patterns of benzodiazepine and hypnotic drugs dispensing after hip fracture among older adults previously on the drugs. What do you think? Will we keep this or not? Does it answer our PPCO question? I've already told you I'm going to eliminate 3 of these. Yes, no.
No.
Right. I probably wouldn't keep this one because it's not going to really answer the question. Fall outcomes in older adults following benzodiazepine Z drug discontinuation. Yes, no. Does this help in any way inform us about our PPCO, which is trying to figure out what evidence-based strategy we can use to help improve outcomes in older adults who are on long-term benzo use?
I think that it could.
I think so too. Yep. So I would say, at least for now, I would put that on the list of like, we're going to potentially save it. Deprescribing benzodiazepine receptor agonists in older adult people with a systematic review. I see people shaking their heads. Yes. Evaluation of a benzodiazepine deprescribing quality improvement initiative for older adults in primary care. Keep or throw?
Keep.
We're shaking heads. Keep. Good. Primary care prescribers' perspectives on deprescribing opioids and benzodiazepines in older adults.
Keep.
I'm not sure if that will answer our question. However, what it might do is give us some clinician expertise that will influence when we make recommendations. So I might keep that one. It might help inform me for my thing. Reducing central nervous system active medications to prevent falls and injuries among older adults. A cluster randomized control trial. What do you think? Yes, no, maybe so. I need some voices because I'm not looking at you.
Yes.
Okay, I hear yes. Anybody on the fence? Maybe?
Maybe.
Okay. So what I might do is I might look in here more and I might like look through and see if like, oh, we get a deep prescribing in here, sedative, hypnotics, which benzos fall in that. So likely this covers benzos. But I might look, let's see. This might have been one that was in a different country. I don't know. So right now I'm thinking that would probably be a yes. Okay, prevalence and types of fall risk increasing drugs identified by stop fall and hospitalized older adults.
No.
No.
Yeah, I don't think so. An age-friendly approach to primary care in an academic health system. Like I'm still confused how that even got in there, but
No.
like with my search
No.
terms, like I don't know. A deprescribing medication program to evaluate falls in older adults. Methods for randomized pragmatic clinical trial.
Potentially, you could use it as support.
Maybe. Medication-related falls in a nursing home, identification in hospital pharmacy interventions. European Association of Hospital Pharmacists. This I
No.
don't actually think is an
No.
article, to be honest. And I would say no because it was in Europe. So like I'm not sure that that would fit. And their health system is much different. So you can kind of see how I went through. When in doubt, I always like will do this more thing, show more, and be able to kind of see the abstract. And so like I can quickly say like I wanted 3 out of there was only 10. So remember, as a last, I'm going to show you 2 more things, then I'm leaving you, unless you have questions, of course. Filters are not inclusion-exclusion criteria. Can we all repeat that? Filters are not inclusion-exclusion criteria. So please, when you turn something in, don't put in there in your exclusion criteria, excluded if not in English language. No, that's a filter. So just, I want you to use the terms correctly. And then, okay, make your lives easier. If you don't know about this, there's this little magical button here, and it says Cite. Everybody see that? Let me pull up a Word document, because I'll need it. Let me open one.
It's a saving grace.
It's a saving grace, except for it's not always correct. So I just want to show you, and you should use these saving graces. So you can do this, and it will tell you, because you're all citing an APA, and you can copy this to the clipboard. And then you can, like, I don't, what happened to my Word document on my Word? There's two things I want to show you here. Okay. Can you see my Word document? Yes, no?
Yes.
Okay, so you can just paste that in there. Be careful when you're pasting this into your papers because it's going to paste with background format. So you can go like this and paste just as plain text. But then you have to go back and you have to italicize this like that, okay? Because you got to follow the format and it's got to be double spaced, et cetera, et cetera. The other thing is that sometimes when you copy this, there's another place that you can do this. Let me see if I can copy this title. Let me just put this title into Google. Okay, so the National Institutes of Health, which comes up as PubMed, it also has one of these lovely features here, and you can hit Cite, and you can select the source that you want it to come. We use APA, so you're going to select APA, and then you're going to hit Copy. If you use this, though, you have to be really careful. Where's my Word document? When you paste it in, you can see here, applied nursing research is not all capitalized, and it should be. And when you cite an APA, this ANR should not be on there. That's a journal abbreviation. So it should only be applied nursing research. Are you following me? You have to verify. And so the other thing, oftentimes, when you copy from either CINAHL or PubMed, the whole title will be capitalized. And remember, titles of journal articles are not capitalized unless it's the first letter, proper noun, or one following a colon. However, I do want to show you in Word, if this, this needs to be all caps, right? Applied nursing research. So you can highlight this. And then you can go up here to this little caret and you can say capitalize each word instead of like going through and hitting like capital N, capital C, like so. Or if this whole title was in capital letters, you could highlight all of this and then you can go up here and you would do lowercase and it'll make it all lowercase for you. Now, I wouldn't do that because that stop fall is okay because it's an acronym. The other thing that you can do is you can, let's just say, I'm just going to just pull this. You can, in chat, which is probably killing a forest, but you can say, please assist with converting this citation to APA 7th. And so, ta-da, like this is also ways you can use chat to help you or to correct your citations if you get all your citations together and you put them into chat and say, please help with the correction. Though I do think that you need to always know your APA and be able to identify errors within there. Okay, so let me go back to this. Okay, so any questions about the search log and strategy assignment?
Can you
Does
just
that
tell me
make sense?
again what exactly is due on the 15th? Or did we change that day? I'm just looking at the syllabus. Like, what's our next assignment that's due?
Okay, so actually the easiest way for you to know this is if you go like this. I'll go to student view so that you'll see the same view that assignments. If you click on this, it has them all like this. So I changed this due date to the 20th. I sent out a message to everybody. And so this was going to be due on Sunday the 15th. Now it's the Friday the 20th. Does everybody already know what I'm talking about?
That's the group one, right?
The group paper, yes. And I will give you a model, if you will, that you can kind of model your paper after if you want.
Is the search login strategy an individual so that we can find our own
Yes.
articles? Okay.
Yep, it is. Now, it would probably be helpful for you, even though you're doing it, is to remember how had you guys create a Google Drive so that you can, for the next paper, the paper that's coming due, is that like you create one in there and everybody edits in there and works on that. Adds references to it, helps with the paragraph structure, helps with the outline, those type of things. The evidence search log, eventually for your final recommendations, you'll have to have a completed search log so that everybody's search string should be in there. So you'll want to save them all cumulatively somewhere. Does that make sense?
Yes.
Okay. But yes, that is an individual assignment for the search login strategy. And like I said, I'll give you a model assignment that you can kind of follow for the paper that's coming up.
Thank you.
Okay, I don't think that I have, those were just a couple of the little things that I wanted to show you just to try to make your lives a little bit easier. Use the tools that are there. Do you have any questions for me? You're just done? Are you ready for me to do your breakout groups then?
Yeah.
Okay, if anybody's having difficulty with I'm just throwing this out there, individuals not attending. Oh, hold on, let me stop the recording.